Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Welcome.
All right, today's episode, Doc. Is it gold or fool's gold? Right? Is that something we say? Fool's gold?
Yeah, I think we could call this one maybe fool's gold.
Maybe. So a lot of our listeners would have received a notice, probably if they're in UnitedHealthcare, that they are reducing or cutting their prior authorization requirements on 30% of the healthcare services that they cover, which
Isn't that a good thing?
That sounds
like
great.
a good thing.
That does sound great. It makes sense to me. We have talked about UHC and this prior auth. We talked about it when the CEO was murdered on the street. And, I don't know if this is a response to that by any means, but what I do know is when I researched it, right, I went into it and started looking at what they're actually talking about, I had some pause because, again, it sounds great. 30% of the services they cover that, need prior auth by the end of the year, they're going to go ahead and reduce that. Now, they also claim that right as of today, they only require prior authorization for 2% of the medical services they cover.
Well, maybe 2% of the medical services, but it certainly is a greater percentage to chiropractors.
I was going to say it doesn't feel like 2% across the board.
No,
but okay.
Yeah, but
That's
again,
what
there's
they're
that
saying.
fuzzy math going on there. Yeah.
Yeah.
It's insurance math, and an actuary figured it out, not an actual person.
Yeah. So their May 5th announcement, their press release included some other interesting information. They claim that of the authorizations that are submitted, around 92% are approved in less than 24 hours.
Approved to do what, though?
Yeah. Okay.
Yeah. I mean, you wonder sometimes when you hear these things, you go, okay, we live in a very small world when it comes to healthcare, right? But, oh my God, where are they getting these numbers? Because when you think about the everyday of what, we go through, fuzzy math.
I don't know, docs out there. Do you think that that in your office within 24 hours, 92% of your requests actually get,
Here's the
approved?
game too, right? They might approve the initial, and then everything after that is like one visit at a time, and you submit 5 pages of paperwork to get it. So statistically, they can come up with 92% are approved up front, but the reality is there's no practicality to it if they're only approving small numbers.
Well, I can see why they want to reduce the prior auth by 30%, because if this is really matter of fact authorizations, what's the point of this program of prior auth? Right? In the first, it's like if everyone passed the test and 100% of the people get 100, what's the point of the test? Like
I don't get this whole prior auth thing, because number one, is it or is it not a covered service? Jeez, there's a thought, right? And a qualified person is recommending it. And what do? You submit it to an insurance company to let someone who's not qualified, who's not seen the patient, make a decision whether or not that patient should receive the care. The whole system is just screwed from the beginning. It makes no sense.
Well,
skewed from the beginning.
Yeah. I want to break down some of this a little bit because introduce AI, because a lot of this has to do with artificial intelligence now sort of taking over. So instead of this prior authorization, when I started reading into this, they are expanding what they call their gold card program.
Hence the fool's gold.
Here's what they define as the gold card program. It recognizes provider groups who consistently adhere to evidence-based care guidelines.
Here
To
we go with
me,
the evidence-based again,
yeah,
right? Go ahead.
to me,
Yeah.
it's just here we these are providers that are keeping within the lines that we want you to stay within. This is the okay, you're playing ball like we want you to. You know, for
Right.
instance, I don't want you to see, your chiropractic visits if it's 10 or less, hey, you're stellar. Like that kind of play within the boundaries of us as the oversight and claims payer.
Mm.
Now, this gold card program requires, instead of prior authorization, it requires pre-registration. So you're
Here we go
actually
again. You know,
yeah.
2 words to say the same
Mm.
thing. Right.
So instead of getting prior authorization as a provider within this gold card program, you're registering your patient before they commence care. Now, there was one thing about this I liked, believe it or not. What I liked about it was within the registration process is built in the verification of benefits and the basically the confirmation that they're actually going to pay, that the service is covered and they're going to pay for it, which is great because verification of benefits these days has become very in itself complex to understand. So if you're within this gold card program portal and you're putting in patient information to register them ahead of the service, I like that the verification of coverage is built in. That's nice to me. I like that part of it.
Well, it's a good thing, but here we go again. We're confirming that the covered service is a covered service. The whole process makes no sense to me. It's a covered service, but now we're gonna confirm that it's a covered service. So, it's not the service that's covered, really, it's our approval of the service that's covered. Because you can have this covered
Mm.
service not be paid, so
Yeah.
therefore, it's not a covered service.
How do you qualify for this gold card program, doc? I'm glad you asked.
I thought you have to get the green one first and prove that you're good with your oh, wait, no, that's something
No,
else. Go ahead.
no.
Yeah.
So you have to be a network with at least one line of their business, right? So you got to be in at least one of their provider contracts. And you have to have an annual volume of at least 10 eligible prior auths in each of the 2 consecutive years. Big deal. That's pretty easy. But the third bullet in this qualification, if you want to be a gold card provider, is you had to have prior authorizations in your office approved at the rate of 92% in each of the last 2 years. What does that really say to you? What does that say to you, doc? Well, what would that say to you?
Well, now again, they're defining what it is that makes that a covered service. So, and they define clinically what the need is, the medical necessity. And I go back to the same old thing. Why am I there? Why? What do you need me for? Why did I go through all this school if all I needed was some insurance adjuster to tell me whether or not that service was an appropriate service for my patient? But it seems like such a backward system that we let the unqualified people decide what happens and what doesn't happen in our healthcare world.
And as providers, you get to know what the insurance carriers are looking for and how much they're going to approve. So it comes down to you're playing their game, in my opinion, right? You're playing their game.
Mhm.
You only submit the
Always.
prior auths that you know are within their specific parameters to get your 92 or more or better percentage of approval. So again, you are changing, in my opinion, you're changing your care plans to fit the insurance company's wants and what their particular parameters are, so you can maintain this status of some kind to then not have to do prior authorizations, but do registrations. Like
Right, but
this is
then it
what I'm
always
reading
ends up
about.
being the same old story. Now you get stuck between the rock and the hard place, and the rock being your patient and the hard place being the insurance company. And you're the one in between them because what you want and what they want and what the insurance company is willing to give are all different. So the insurance company says one thing, and then you say a different thing. And then all of a sudden the patient says, yeah, but this is what I want. And then they call the insurance company up, and the insurance company said just what you said. Well, if they just bill it this way, or if they just code it this way, or make sure they answer it this way on question number 5, then everything will be good, regardless of
Or
whether it's the truth or not.
or stop asking for visits after a certain number because or a certain, frequency or duration because it's going to be a hard no and you don't want to
Isn't it the
compromise
real?
your gold
Yeah.
card status
Yeah.
or gold programs, whatever it is. And by the
Isn't
way,
that the
this is
real goal?
across
That's the
all
real
their
goal.
yeah. And this
Yeah.
is on all their products. That's not just commercial. That's individual, it's Medicare Advantage, it's Medicaid plans, dual eligible plans. This is everything.
Right, because now they're taking 2 things that happen in the world, right? Number 1, they're taking the murder of their CEO as motivation to say, "Look at us, we're making change, we're making life easier for you and your provider," number 1. So number 2, all the fraud that's going on that's being detected across the country, they look at that and say, but we have to do something because there's just all this fraud being perpetrated by the provider. So, like I said earlier, what good is it if they don't believe us? And now, unfortunately, all this fraud that's being discovered gives them reason to not believe us.
And then on top of it, in that advanced notification requirement, that's you as a provider office now with more administrative burden because now you have to log into the UHC portal and then fill out all this information about this patient that you really haven't seen yet, but you're wanting to, but it's advance notice. So
I never understood why the patient doesn't get stuck with some of this because all those questions can come from the patient. Why you haven't even seen this person, so any information you're gonna give them can come from the patient. Why do you have to be
well,
burdened with this?
oftentimes, and I haven't seen the advanced notification process with UHC yet, but oftentimes it's both a collaborative. It's information you need from the patient. Oftentimes it's like a functional outcome assessment tool or something. So now, do they have to be in the office and answer a bunch of questions for you to then stop, go into this portal, pre-register them? Like, so then everybody's doing something, except the insurance company has set up an AI algorithm to just say yes, no, or maybe. You know.
Maybe.
Oh,
Give me more information. More information. More
by
information.
the way, this gold card program does not exclude them from guess what? Asking for more information if they need it.
Yeah,
You mean perhaps getting a prior auth down the road? Just
right.
saying.
So once you're registered, you're qualified to do a pre-authorization
Yeah, right?
for approval.
Well, because they say if you don't if you don't register them in advance, then the claim will get denied. So that's it.
Right.
Now, how will it deny? If you're a network, I imagine that if I'm in network and I don't do this pre-registration requirement and it gets denied, I imagine the remark code is going to be CO for contractual obligation,
Right.
meaning I can't
So
charge them.
not only can do you not get the approved visits, you can't even charge this patient self-pay. I mean, the
Yeah.
whole system just, you look at the system and you go, okay, no, I don't want to do this. I don't want to play this. This isn't something I want to do. And it would all be different if we got paid well enough to accept the added administrative burden. But of course, we don't. The rates are just ridiculously low and not worth the time.
Oh, and by the way, on the flip side of this, what did we learn? What did we just learn about Medicare?
I love it. Let's flip it, right?
Yeah.
Medicare is also looking they're doing 6 states, I believe. There's 6 states with limited number of
Yeah.
services that they want pre-authorization. They wanna go the
Yeah.
other way. They
Yeah.
want pre-authorization for certain services in Medicare, and it's a trial test program that's going on. Thank God, it depends on your state, but I mean, certainly and it doesn't affect anything in chiropractic right now, but God forbid this thing works, right?
Well, and listen, so yes, Medicare is going the other way with prior authorizations with original Medicare in a pilot program in 6 states with 17 procedures. Here's the part that in my analysis, my skeptical analysis, the prior authorization process is not going to be done by CMS. It's going to be done by private technology vendors using algorithms and clinical reviewers to decide whether that procedure should happen at all.
Yeah, and his so let's flip that a little bit, okay? We look at that and say, "Oh, boy, another layer, another Medicare layer," or whatever, but when we talk with our clients, one of the biggest problems they have is translating that Medicare is a limited service, even though they advertise it to be unlimited, and we know that they have to reach maximum functional improvement, then Medicare no longer covers that service if your records were to be reviewed. Trying to get that across to a senior patient who will never actually get better. They only feel better, but without the care, they may start to regress. So all of a sudden, there's this position you have to take that appears to be contrary to what they're being told by Medicare. Now, maybe with this, might bring the two in line. That Medicare will say, no, you are done. We're not going to approve any more visits. And if you want to continue to see that provider, you'll have to pay them cash.
Here's my problem with this pilot program, and it's always been my problem with these kinds of programs. The private vendor that's going to be handling the prior authorization approvals or denials, they are paid by earning a percentage of what CMS defines as adverted spending. So they're
But you're such a
compensated.
cynic, Paul. You think that they're going to cut services to make money. No, they're going to do this legitimately. You're such a cynic.
Yeah, well, when you get paid to not pay it, approve a claim,
Oh my God.
one
I
would
know.
imagine that the incentive by these private vendors, right, would be to make more money because they're private entities. They're for-profit entities. I don't care if you want to call them nonprofit. They're for-profit, as far as
For
I'm
profit.
concerned.
Mhm. And
They're looking
probably
to
not
make money.
doctors.
Yeah, they're not.
Probably not doctors.
Oh, it's gonna be algorithms. It's gonna be AI with somebody's clinical name slapped on the top of it. I mean, it's not to me. It's like capitated plans where, the provider, the PCP gets a certain amount of money, and if they have to refer out to a specialty, they get less that month. Like,
Yeah.
it's really these are opposing forces. And so I I can see why there's sharp criticism towards these pilot original Medicare prior auth programs because much like I mean, what's the point? The point isn't just to stop waste and abuse. And we both know that there is a ton. It's very unfortunate that there's so much abuse and so much waste and fraud in the Medicare system. We've seen it. I mean, you've seen headlines across the country in different states. We know that
Constantly.
DME providers have been one of the biggest sources of this. But now we're seeing in other sectors. So I get it
Yeah.
about the
But again,
fraud.
it's an overreaction. It swings this way, and so you have to respond, and it swings just as far the other way. And it reaches a point where you go, the only people getting hurt are the providers and the patients. And when it comes to Medicare and chiropractic, is there anything more you could do to put us between us and our patients?
What I don't get is the small fractional potatoes that they want to focus on in chiropractic. Because original Medicare, as we know, original Medicare only pays for 3 out of the tens of thousands of CPT codes, right? They
Right.
pay for 3, and they don't pay that much, and they pay 80% of not much. So, to it just seems crazy to me that they lend themselves to focus in on such a small portion of a specialty, you know?
Well, especially when they're talking about billions in fraud. Yeah, billions. I mean, you can't even use the number from any one of these states that we're hearing about in the news to account for all of what's paid out in chiropractic in the course of a year. So the problem is that we are not separated as much as we like to think we are. They roll us into the same big ball that everything, oh, fraud, fraud, fraud. Boom. They roll us into that same big ball and we're going to get swept up with everybody else. And truth is, they could eliminate chiropractic from CMS altogether and it wouldn't impact the budget one tiny little bit.
Or I could go the other way with it. If original Medicare just said, like, "We'll cover 24 chiropractic visits a year. I don't care what they're for. Just call it that."
Oh, I'll give you the softball here. When in the old days,
Oh, here we go.
12 visits a
Mm,
year, and you had to take X-ray every year, but they wouldn't pay for them. They
yeah.
required X-ray every year. They wouldn't pay for the X-ray, and you got 12 visits a year.
Was X-ray invented back then?
Yeah, yeah, the little gerbil was running on the treadmill, but we got the
Yeah.
power.
Yeah. Yeah. Here we go.
But, I mean,
But you know what
most
I'm saying?
people,
Like,
that was better. That was a very good system. They covered what you did. You used your 12. Everybody used 12. And then once they were, quote, on maintenance, they would come in and you could use the 12 for maintenance. But when the 12 was over, the 12 was over. Everybody got it. And that was the way the system worked. Now, unlimited chiropractic care for medically
see,
necessary
it doesn't
services.
that doesn't make any sense to me because what percentage of the population, doc, in general uses chiropractic?
It's like 17%.
Okay. And
Some have 20.
okay. And if you look at the Medicare population, right? They may or may not use more of it depending, you know. But my point is that I dare say ask if you ask most chiropractors, I bet they'd be thrilled to say, "Okay, I'll take 24 visits that are
Oh,
under whatever, just chiropractic. I don't have to
any
prove
plan.
anything, any
Any
medical
plan.
necessity." Yeah,
Yeah.
and just call it a day.
Yeah.
Like, it seems to me that wouldn't break the bank. It would make it a life. And then all that money they use to go into trying to fight paying a chiropractor, 40 bucks, they could use to fight all these billions and billions of dollars of fraud instead. Like,
Yeah. It's a different column on this spreadsheet. We've said this before, there's the cost of chiropractic care and then there's the cost of fraud management. And if fraud management column goes up, but I mean, a chiropractic column goes up and the fraud management goes down, they think they've done something effective. So yeah, I agree. It's the system's all screwed up. And who needs chiropractic more than seniors?
yeah.
Really, of everybody in the world, by the time you've hit that point in life, I don't know anybody above the age of 50, and everybody below it too, but we'll say above the age of 50 that doesn't absolutely need regular chiropractic care just to maintain maximum function.
I just find it really funny that here you have the biggest insurer in the country, UHC, pulling back from prior authorizations, which to me obviously has to do with the financial picture. And now you have original Medicare going the other way, the government going the other way. What does that
Well,
tell you?
we know that United is just rewrapping the whole
Yeah.
prior auth thing
Yeah.
into a different package. It's still prior auth, register, do this, do that, make sure you're 92% or whatever. It's still prior auth. It's just packaged.
Well,
It's
you
just
know what it is?
repackaged. It's rebranded.
It is smart on their part because now they get that data from the first visit right away. Instead of like waiting for 8 or 10 visits
Yeah.
and then going for prior auth, they get to know who's meaning their AI systems will get that patient information right off the bat.
Yep.
And the more data you get, the more efficient your AI gets for how you want your AI to
Yeah.
work. And that's exactly what's happening. And what the problem with the CMS format is with this prior auth and these private vendors is that CMS has yet to, as far as I have seen, they have yet to respond to people's stakeholders' requests as to where is the conflict of interest protections with
Mm.
the vendors, how they pay them, how their AI assisted reviews are happening, and is there a human oversight in this process anywhere?
Well,
Anywhere.
here's my paranoia that really carries it to an end game here. My belief is that all these insurance companies are manipulating the system to eventually get to the point where they connect to your office EHR, EMR record systems. They're gonna connect so that all of a sudden, if you want certain amount of care, if you want something they're just gonna, like you say, AI is gonna log into your system, they're gonna read the note, and they're gonna decide, and it's all gonna be automated. How many times have you gotten a request for records, and they give you the option to let them come into
Yeah,
your
I
system?
know. Yeah.
Who would be, like,
Yeah,
crazy enough in
I know.
chiropractic to
Well,
let them in?
but here's the rub. Now that most EHR vendors are moving to a browser-based system, how will you ever know if they're
Oh,
in there? You just
yeah.
won't. You won't. There's no way.
No way.
They'll
That's
tell
right.
you, "Oh, well, no, nope, that can't happen." But
We taught this model 10 years ago that the ultimate goal is this: no people, your computer talks to my computer, let's do lunch, right? That's gonna be what it ends up being, and they are technologically already there. They just haven't been able to make the system be as big as they want yet, but technologically, they're there. They could do this tomorrow.
yeah, but if you're not discerning enough as a provider,
Mm.
you're looking at the headline, UHC reduces prior auth by 30% by the end of the year. Chiropractic's on that list of removing prior auth. And you're saying to yourself, well, it's about time they finally listen to the people and they get the
Yeah.
providers are having so much, and this is what's happening. So, yay.
Yay.
Now I like UHC or whoever, fill in the blank,
Yeah.
whatever carrier
Uh,
you want without
checks in the mail.
understanding, right?
Yeah.
And it may actually be better at first. But what's the end game, as you say, with all of this? And doesn't it sound great when they say, well, with a fully integrated, system of AI and
Fully in
EHR, your patient goes into your system and whatever carrier, they walk out the door, your claim is already paid and going to be deposited the next day. How amazing is
oh,
that?
oh.
It
Isn't
sounds
pre-auth
great.
Latin for big brother?
Yeah. I mean, it does sound great on the face value,
Oh,
but
that's how they do it, carrot
yeah.
and then stick, right? So,
So it's again, it's funny the dichotomy of private carrier moving away from prior auth, the government, Medicare moving into prior auth. Like that's so 10 years ago,
yeah,
man.
yeah. Who gets the gold card, right?
Yeah.
Yeah.
And frankly,
Oh,
I
well, see,
wouldn't
now
want the gold
th
card.
there we go,
Yeah.
government, private, but one thing's
Yeah.
for sure, we're in the middle getting screwed.
Well, because UHC does administer Medicare Advantage plans, and that's on the
Sure.
list of moving to gold card program and registration versus prior authorization. So, To me, none of it makes any sense anymore. I don't
Yeah.
get it.
Oh.
I mean, I get it. I get why they're doing it. I just don't like the BS that they're floating out there on the headlines.
Right.
Like,
And ultimately, if it's good for them, it's very rarely good for us. How's that for a closing
rarely?
thought,
How
huh?
about never?
Yeah. Yeah, we'll leave you with that closing thought.
Yeah.
Always be leery when an insurance company says, "This is good."
Yes. It is. It goes back to the all things that glitter are not gold,
Right.
or a gold card program for that matter.
Oh, fool's gold.
Yeah, exactly. So, boy, that was a fun one. I just was able to like ring out my insurance rant and bitch and moan about.
That's a good thing. Yeah, that's
Yeah,
a good thing. Yeah, yeah.
yeah.
And
Tell me you
everybody's
don't
on
feel
the
that
other
out
side
there.
listening to this going,
Yeah,
"Yeah, yeah."
yeah. Tell me you don't. I get why you
The
want to
only
go to
problem is you won't be able to watch this episode unless you register and pre-authorize the
Oh
ability to
God,
download
can you
this
imagine
stuff.
that? Yeah, yeah, yeah. You can listen to this podcast anywhere you listen to podcasts as long as you pre-register and give us all your data.
Yeah, yeah. And
Give
then
me a
we'll
break.
decide whether we want you to listen to it
Yeah,
or not.
yeah. You'll get the first 6 episodes, and then
Yeah, or maybe the first 6 minutes.
yeah. Oh, yeah, yeah. There we go, there's something, right? Oh
There
my
you
god,
go.
I don't even
Yeah.
know.
Um, uh,
I don't know what happened. We get off the rails, but
I
that's
know.
alright.
We always do.
Yeah, alright. Well, thanks again for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Thank you.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.